Welcome back. If you just joined us, it's the 11th day of September 2019. Welcome once again to Daybreak. Of course, we've just taken you through our news and other updates. Time now for the discussion of the day. And today we're looking at matters food security, ending famine and strategies for dealing with famine, because dealing with drought is a whole issue altogether. But the effects of drought, which, in some cases is famine, is something that many economies, many countries have learned to deal with. And what lessons can Kenya learn in regards to that? Now, remember, 6 of 23 counties that are facing drought are listed on being on alert. That's a step away for the actual famine for residents. We're also told that 2.6 million Kenyans are affected by the drought situation currently going on in the country that has persisted over the last 8 months. And this is according to some data given by Devolution CS Eugene Wamalwa recently, who says that that number is higher than the 1.1 million Kenyans that were estimated to have been affected by the drought earlier in this year. Right, we have some guests here with us who will help us take a look at the various issues. And of course, you can weigh in on this as well. What ideas do you have in terms of strategies for ending famine in this country? Does it make sense that in 2019, there is still a section of this population that cannot get access to a regular supply of food? 224 is the SMS line. The hashtag is Daybreak. You can also call in. We'll be displaying the numbers on the screen shortly. And at Wahige Mora, at Zinzi_K, the necessary handles on social media. But let me introduce my guests now. I'll start from their far right. We have Patricia Nyinguro, who is a climate change expert from the Met Department. Welcome to the program.
Thank you very much.
Right next to her is Dr. Joshua Orwa with Bliss Healthcare, also helping us to get some understanding of matters nutrition. Welcome to the program, Daktari.
Thank you.
We have Stella Kimani, who is the Deputy Secretary General, Nutrition Association of Kenya. Welcome to the program.
Thank you.
And last but not least, a man with many titles, but for today we'll use the one of former Agriculture Minister, Kipruto Arap Kirwa. Welcome to the program as well.
Thank you.
Patricia, let me start with you. And I actually wanted to start by displaying a map, which I don't have ready yet. So when I do, I'll put that up on the screen. But nevertheless, this map basically shows different parts of the world and the global hunger challenges that each part of the world faces. But when we put that up, oh, we have it now. Oh, great. Okay, let's put that up on the screen. And just to help you understand the colors. Oh, great. So the areas of green are areas where, in terms of hunger issues, it's low. A lighter green is moderate. That means there are significant hunger issues there that cannot be ignored. So Egypt, Morocco, Bolivia, Ecuador are in the lighter green sort of section, while low is, which means that they've basically figured out how to deal with getting food to their populations, is deep green. Now, areas which are of serious concern are a light brown. My reading of colors sometimes can be quite off. Forgive me, some of my guests might be wondering what color is that he's seeing. Is someone saying, is that maroon really? No, a light brown. No, I don't think so. I would say tan. I would go with tan. Oh, okay, but on the screen it looks yellow, and Kenya is part of that yellow as well. This is serious hunger issues in regions like that. And then alarming areas are sort of a darker brown there, and that's Chad and Yemen as well. While extremely alarming, let me see where that is, the Central African Republic. You can see it's right there in the middle of the African continent as well. And for you, Patricia, when you look at a map like this, how does that align with your research on climate change? And is there a correlation between access to food and, of course, sort of how the different climates in different parts of the world are at this particular time?
Like you rightly mentioned, the climate varies across the globe, and as such it determines what type of economic activities or how we can be able to produce food. For Kenya, mainly our agriculture is driven by rainfall, and the rainfall has become erratic, especially in recent years. So we are seeing we have more years with droughts than in the past, and as such then it complicates the issue of agriculture or farming based on rainfall. Based on rainfall. Yeah. Okay, Kipruto, I also want to bring you into this particular discussion, but for you I want to understand the governance around famine. Drought is a different issue because drought could happen anywhere in the world, and it would be wrong for us to say that it's only Kenya that experiences drought. But dealing with famine, especially on the African continent, seems to have been a big issue since independence. When you look at the Kenyan scenario, since devolution started as well, why is it that we've been unable to deal with the vulnerability of people in certain counties? How hard is it? On one hand, we are told Kenya is food secure, but on the other hand, there are communities till today that still have to wait for relief from Nairobi.
Well, I think the main challenge lies in our ability to store what we harvest in terms of grains. In a number of cases, we lose almost up to 30% of the grains that we harvest. This therefore means that the ability to produce may be there, but in terms of post-harvest handling, we are poor. The second challenge is, of course, the issue of logistics. At times you may have food in one county and the next county is suffering from lack of food just because the logistics are not right. But more important is that we need to have integrated food security program, in the sense that where there is livestock production, we should ensure that measures are put in place such that there is clear offtake for livestock farmers before the drought sets in, because drought is something that can be predicted, the way Patricia said. But therefore, you should be able to do an offtake of the livestock in that particular area, and also socialize farmers to understand the economics of ensuring that you have a smaller stock and you can replenish when the drought is over. Okay,
it sounds so simple. Why, if it is, and why isn't it?
You know, the problem is that we've been avoiding infrastructural development in terms of livestock subsector, because it entails heavy investment by government, creating some feedlots the way it is done in Namibia and even in other parts of the world, like in Australia. This therefore means the government must go out of its way to address that issue of what we call feedlots, and it will also ensure that there is less insecurity in those areas, because the movement of livestock is limited by the fact that they are clustered in certain feedlots, numbering like 4,000 head of cattle and so forth. But the problem is that the government has been taking the lazy option, that you go to Kimalel and you just do some auction of goods and you say you have assisted farmers to do that. This therefore means we must get out of this, the easy option of just allowing farmers to the vagaries of the weather.
To allow farmers to deal, just at the whims of the vagary of the weather. Yeah. All right, let me also bring Stella Kimani, Deputy Secretary General, Nutrition Association of Kenya. Feel free to respond to what any of the other panelists have said, but some would say it's not just about getting food to those affected, but specifically the kind of food that will provide them with the nutrients that they need. What challenges would the people that this food is now being distributed to face at this time? Because it's not just any food that they need. Go ahead and just help us understand this better.
First of all, I want us to start by understanding that the hunger issue is more serious than what we are seeing. Okay. What we are seeing being reported is mostly what is called acute hunger. Now, acute hunger is mostly what will be reported when we have the drought issues, and we have periods that people have stayed without feeding. Then we have the chronic one. Now, the chronic one is where people stay for extended periods of time, like for the 6 counties you mentioned. So this person has not fed for a very long time. So even their gastrointestinal system, the digestive tract, has almost is now having issues with digestion of that food. Then we have what most of Kenyans are going to have, hidden hunger. Now, hidden hunger, if we were to start discussing it, you realize probably even the panel here, some of us are going to have those issues. Because this has to do with specific nutrients malnutrition. So when we're talking about hunger in this country, we tend to talk about mostly the availability of food, and we look at anything. As long as it's available to be eaten, then we consider that household a little bit food secure. But if we start talking about chronic hunger and hidden hunger, that is causing us serious health issues. And you realize that even our health budget is going to go higher because we have people who are sick because of hunger issues. Now, back to your question about what we are feeding these people who are already hungry. You'll realize that when the Ministry of Interior and the people who are taking relief food to these people who we are saying have hunger issues, what is being taken there? Juices, maize and beans, sometimes bread, yeah? And this is a person who has not even been digesting food for a certain period of time.
I'm told there was even a picture of a grandma with taking a soda or something like that.
Absolutely.
Sort of relief food, yes.
Yes, you're going to kill that grandma or whoever it is. Because what happens is when your digestive system has not dealt with food for a certain period of time, when you're starting to feed it, you have to start very slowly. It's like the baby's learning to walk again. You give the system food in bits so that you're not bombarding it with a lot of blood glucose or nutrients in a very short period of time, such that this person dies not from the hunger itself that they originally had, but what we call refeeding syndrome. So we are doing it wrong. And then what are you taking to somebody who has not been eating? Maize? Come on now. We do have foods that are specific for people who are malnourished, and I need the government to understand that. We have ready-to-use therapeutic feeds, because when you're extremely hungry, you're now having disease. It is classified now as disease. Yeah? So that person needs to feed on food that is extremely easy for their system to digest, so you're not killing this person from a problem you're trying to solve.
Okay.
Yeah.
So when you hear the devolution CS saying we have this under control, your opening statement did not sound like there's anything under control.
If you ask nutritionists in this country, and as Nutrition Association of Kenya, I can clarify to you and tell you right now, we don't have it under control. The nutritionists on the ground can tell you the amount of hunger on the ground is more serious than what we're seeing being projected by the government. In fact, I'm seeing that figure of 24 counties, and you know, it's not making sense to me.
It's not making sense to you.
And your hospitals should give you that answer. The fact that your curative budget is going very high, it means that the chronic hunger and the hidden hunger issues are very serious, and more serious than what is being projected.
Okay.
Yeah.
Okay. Let me allow also Dr. Joshua Orwa to weigh in on this. Dr. you can carry on from where she left off, and even give us your thoughts on matters of food security and of course nutrition as well, and the importance of not just giving any food, but ensuring you're giving the right food for the right needs at the right time.
I'll probably take you back to the map we started with.
Okay.
When I look at the yellow areas, for me, I don't just see the present. I'm worried about the future also. And in this sense that malnutrition or this food insecurity, as it were, will affect us not just now. The children who are not getting enough nutrients today will die younger than they're supposed to die. They may not pass the exams that they could have passed because their IQ will have, just as my friend has said, chronic hunger. It affects even their IQ, so they may not even make it in terms of academic achievements in school and everything. And so when we talk of food security, maybe we should look at it not just as an expense, but as an investment for the future, in the sense that what we invest today will bring us returns. We'll have a healthier population that can produce, will be more productive. Again, it will clear a lot of diseases that we're now dealing with. Estimates put it at about like 53% of the children who die under 5. The causes of death could be directly or indirectly related to malnutrition. So imagine all those people dying, and they're getting diseases that we're still spending money on to treat. If we could have treated the underlying cause, if we could have made sure they had enough adequate food in the first place, then probably we wouldn't be spending money treating these things that are killing them. Okay. Yeah. So when we look at food security, many times when you talk about it at a country level, we are thinking about the population, the entire population. But the definition of food security as given by WHO actually focuses on the individual. It says all people at all times should have adequate, safe, sufficient and adequate food to meet their dietary intake and food preferences. So yes, we may discuss and say we have this in control, we have this in control, but at the individual level, at the household level, you walk around the hospitals and you find very many people who are malnourished. Even in areas where we think we have adequate food, there are people who are, don't have, they're extremely food insecure, if I may put it that way. Okay. Yeah.
Stella actually introduced us to the term hidden hunger, and I found that very interesting. And I want to let our viewers know we can now open up this conversation to you. 22422 is the SMS line. The hashtag is Daybreak. Surely we'll be projecting a question for you, but also you can call in. What are your thoughts on our discussion today? And we'll be displaying the numbers on the screen shortly as well. But let me come back to Patricia and get your thoughts on this. When I look at that particular map which we showed earlier, really a lot of concentration around the African continent. The color there is something that one should be worried about, especially because it's about a serious hunger issue in several countries on the African continent. Is it a climate issue only? Is it a climate issue at all? Others are saying it's political. That in 2019, if people cannot get food in a country, that shows lack of political will to actually deal with that issue. What are your thoughts on this as a climate change expert? Can you really blame the weather?
Well, the weather plays a great role, like we've already talked about, but we cannot entirely blame the weather for what is going on. As was mentioned by my colleagues here, it really is a management issue. We have the science that tells us what we expect. We have early warning systems, and if these were put into better use, then we are able to cope with all these challenges that we have. Yeah, so it's really, we can't really place all the blame on the weather, even though being on the equator, being in Africa, we face more dynamic weather than other parts, but still we cannot entirely blame the weather for what is going on.
What will this map look like from a weather perspective in the next 50 years? What are your predictions?
So according to the predictions up to around 2050 and even beyond, we are seeing that we expect more in extreme events. So the droughts that we are having, we expect them to be more severe and more frequent. And the rainfall events are expected also to be more severe. So we might have on an average higher amounts of rainfall, but falling within very short periods of time, making it completely useless for agriculture unless we do something about it.
Okay.
We advocate a lot for water harvesting, which in the future will be very, very crucial, because if we have an entire season's rainfall falling within 10 days, in the past it would be very useful if it fell within a longer period of time, but in the future, because it will be within shorter periods, then things like water harvesting come really into play.
Yeah. Okay, and I'll come back to you and just try and figure out whether the drive to green Kenya or bring a lot of reforestation, whether that could help change the way the map looks moving forward. But I also want to let our viewers know that what ideas do you have in terms of strategies to end famine in this country? And you can see already a lot of the ideas are public knowledge on this table as well. But in case you have other thoughts on this, please let us know. 22422 is the SMS line. Your ideas on how to end famine in this country, let us know, and I'll be reading those even as we continue. Kiprut, I want to pick up from where you left off. We started a discussion about infrastructure.
Yes.
And when you talk about hunger in a country, the infrastructure of a country plays a key role in getting food to the right areas at the right time. Now, there's a study that noted that poor infrastructure means transport costs account for nearly 2/3 of the cost of relief food like maize, and that maize moving from a surplus area to a deficit area is levied multiple local taxes for traversing different local government municipalities. Talk to me about those issues.
Well, it's very interesting. I remember at one time a bag of maize was going for 1,000 in Kitale. And to transport from Kitale to Moyale was going to cost 2,700. And that's when we made a policy decision.
This was what year?
When I was minister, between, I think, 2004. So we made a policy decision that the stores that were on the border on the southern part of Ethiopia, within Kenya, we opened them up now to receive maize from southern Ethiopia, and people are going to just cross the border with their maize, and we buy from there so that we mitigate on the issue of costs. But the fundamental issue is broken into two: availability and also ability by the individual. Because as Dr. said, the issue of food security goes beyond just availability. It goes beyond availability, because food may be available across the board, but I will not be able to access it because I have no ability. This therefore means we must arrest people from getting to areas of food insecurity. How do we do it? Ensuring that each person in Kenya has the ability to access food of nutritional value that is acceptable and also in sustainable manner. What do I mean? You don't have to grow maize or potatoes for you to be food insecure. Whatever enterprise you engage in should ensure that you have enough income that will allow you to access food in sustainable manner and of nutritional value.
Okay.
So that is where the foundation of all these issues of food insecurity lie. What I mean by infrastructure is not just the road. It's for the government to create even issues like abattoirs, but in an integrated manner, such that one area does not do so well and some other areas of the country don't do well. While we say agriculture has been devolved, it is important that the policy decision still lies with the national government. This, therefore, national government must have an aggregate of all the issues of food insecurity and food security, such that the sum total of it is a clear picture that the country is secure.
One solution that the national government has proposed time and time again, and even earlier this year, I believe the Deputy President said it's going to happen, the dams in different regions to plug in at a time like this. In fact, I think the number that was given in March was 57 dams. Again, uncertainty of whether how far that plan is, but
57 dams is a smaller number, and this will be just scattered in some certain parts of the country. The best solution is to do what Swanaton did in 1954, and he was just a junior officer in the Ministry of Agriculture. He opened so many water pans in Maasai land. That ensures that you also arrest the erosion, because every year in Africa we lose 3 feet of the soil to the ocean. And therefore the best way to do it is to have water pans and ensure that we also create some kind of microclimate by ensuring in some of those areas we make them green. In that way, we'll be able to sustain the areas where livestock will be reared, and also ensure that food crops in small amounts around those water pans are going to sustain the families that live around the areas.
Yeah. Okay, Stella, let me also ask you this, and I'm sure as part of your duties with the Nutrition Association of Kenya, you've had a chance to see how other countries are ensuring that there is adequate nutrition across all its communities. Are there no long-term measures to build resilience within marginalized communities? We know where they are. We know what's been happening since independence. What have you seen out there? What have you heard is being done out there that we could not copy necessarily, but learn from?
Part of what I have seen that we can replicate is starting the food security conversation right from household level. Because if a household is not food secure, then it's cascaded to the county level, and it becomes a burden at the national level. So we need to start educating right from the household level on how they can be food secure. And Mheshimiwa was very right. If you don't have to plant food for you to be food secure, you just need to have a source of income by which you can be able to access food. But before you access that food, we need to ensure that a farmer somewhere is not throwing away their excess produce because they don't know how to get it to the person who does not have the food. So it's a whole cycle that we need to take care of. From the person who is doing the food production, that's the farmer, they need to be educated on a more sustainable way of doing it. You cannot be planting a type of seed that is not going to withstand the weather conditions and expect a harvest. It's not going to happen. And then now we need to work with the weather people. Now, by the time you get to drought, there's a certain sequence, there's a way of predicting it before it happens, and my colleague talked about it. The soil moisture levels, there's so much you check into that will have already warned even the people in the agriculture sector that, look, we have a problem coming up, so how do we sort it? And that is where now the water conservation areas come in, like the dams and that kind of thing. So that entire cycle, before you even start producing food, you need to start with education. Why do you need to be food secure? And it's not just about having anything to eat. Why do you need nutritious foods? What are nutritious foods? Start teaching it right from the lowest level of education in this country. And we used to have it. 4K clubs, what happened? Disappeared. We scrapped off agriculture from our education sector. Other countries are doing it. I mean, we don't even need to go to Israel to do this kind of, what is it called? Benchmarking that we see politicians do. I mean, right here in Turkana, we have this Catholic NGO that has been doing farming in what would otherwise be classified as a place that you cannot grow food. So what are we not doing right? It starts right from information and us handling our issues right. We're just not getting it right. Yes.
But it sounds like you're speaking about a population that is empowered, that has an income, that has access to information and access to education. What about those who do not have any of the things that you're talking about? How do they cope?
Actually, a majority of Kenyans now lie in that segment where they don't have information, because you'll find even the most educated person not knowing what hidden hunger is. And they will have the hidden hunger. So that takes us back to our education of what health is. We have just not really cracked it. We keep talking about the universal health care, but we need to start with universal self-care. The person at household level needs to know, for me to be healthy, I need to be food secure. Now, if I cannot do farming, which most people can actually do farming, unless you're in a very drought-stricken area, even urban farming, your balcony, your kitchen, you just need a space where you can be taught on how to do the modern farming in sacks, in water bottles. There's so many options. Now, that person who does not have any source of income, because I mean poverty is one of the key contributors in global hunger. Now we need to figure out how we'll deal with that poverty issue, because as long as I cannot afford food, and that is what my colleague talked about, accessibility. If the food is there and I cannot access it, then I'll still end up malnourished. So it's a lot of issues we need to deal with. One is poverty, the other one is food production, the other one, we need to have seeds that can actually withstand the changes in weather, and we have experts who are helping us with that. And also now we need people educated on what nutrition is, because half of Kenya has no clue, in fact more than half, has no clue on what nutrition is. You think just putting stuff on a plate, shoving it down the mouth is nutrition? Absolutely not. You'll end up sick. And that's why we have a lot of the walking dead. I told them the walking dead because we have people who are sick on the inside, but on the outside they look okay. So we need to go back to understanding what it means to be nourished before we even talk about now these other issues. But accessibility has to be at the core of it.
At the core of it?
Yeah. Okay.
Before we allow the other panelists to respond to that, we do have some of your feedback, tweets and SMSs. Remember, 22422 is the SMS line, and the hashtag is Daybreak as well. Let's see what our viewers think about our conversation this morning. Okay, let's start with SMSs. Nixon Dugire from Kindaruma. Good morning, Nixon. You say that a lot of maize in the country has been affected by wow, what a name. Reilanas Fecelthexa. Wow, okay, I'm not even going to try that. A fungus that turns the cobs black and sooty. What is being done to correct this and prevent a recurrence? Okay, that's an interesting question. Abel from Eldoret says, our weather stations should use the latest technology to give the farmers a real-time weather forecast. And we have someone from the Met Department. I'll get that question and a response from them on that. Okay, those are SMSs. Okay, now let's go to tweets. Mbuko says, eating nutritious food and vegetables is key to addressing the hidden hunger. Only 6% of Kenyans eat the recommended amounts of fruits and vegetables. We need strategies to make fruits and veggies accessible and affordable to all. Okay, and we have two nutritionists here to help us get into that. Someone else here, I guess no name, you say, grade 4 science, plants need water to grow, not rains or dams, etc. We need to get innovative and come up with affordable pest and water management interventions. This will be a game changer. Access to food counts too, thus movement from point to point should be availed. Okay, Sagioko, that's from you, thank you. Okay, we've already read this. Let's move on to the next one. Sam Oindi says, it's immaterial that we as a country are still discussing issues of food security, a thing successive governments would have addressed. Lack of planning and preparedness. Okay, thank you. We'll talk about that as well. We have another one now. Somebody says here that the fact is agriculture being the backbone of food security in the nation depends heavily on natural rain. Climate change or drought warnings must be given priority. Warnings must be acted upon in advance. Engineer Lazaro, thank you for that. And it's a good point now to take a quick break, a quick breather for you who is watching. But stay tuned. When we return, we'll get some feedback from our guests on some of the questions and points and comments that you have made, and also really discuss solutions, hoping against hope that stakeholders in relevant sectors are listening to this discussion, because as one viewer said, it is a shame that in 2019 we're still having discussions on food security in Kenya. Stay tuned. You're watching Daybreak. We'll be right back.